Did you know that a virus similar to smallpox is making a comeback? Monkeypox, once thought to be a rare and contained disease, is now spreading globally. Are you at risk? And how can you protect yourself? Monkeypox might sound like an exotic, far-off disease, but recent cases have shown it can spread much closer to home than you might think. Understanding the signs and symptoms can be the key to early detection, and knowing the treatment options can help you and your loved ones stay safe. We're going to break down everything you need to know, from the early signs and symptoms to watch out for, to how you can protect yourself and what treatments are available. If you want to be prepared and stay informed about this health issue, stick around. Monkeypox is a viral zoonotic disease, meaning it is a virus transmitted from animals to humans. It is caused by the monkeypox virus, which is a member of the orthopoxvirus genus, the same group of viruses that include smallpox. Monkeypox typically presents with symptoms similar to those of smallpox, though it is generally less severe. For decades, monkeypox was mostly seen in Africa. But it's occasionally found in other countries, including the United States. In the summer of 2021, a case of monkeypox was found in a U.S. resident who had traveled from Nigeria to the United States. Then, 2022 brought outbreaks to regions outside of Africa, including Europe, the Americas, and Australia. When it comes to monkeypox, recognizing the signs and symptoms early on is crucial for managing the disease and preventing its spread. Let's break down the symptoms into stages, starting with the early signs that usually appear within 5 to 21 days after exposure. Initially, monkeypox presents with flu-like symptoms such as fever, headache, muscle aches, and backache. You might also experience chills, exhaustion, and, importantly, swollen lymph nodes, which is a distinguishing feature of monkeypox. This lymph node swelling is not typically seen in diseases like smallpox, so it's a key sign to watch out for. As the disease progresses, the symptoms evolve. Within 1 to 3 days after the initial fever, a rash begins to develop. This rash usually starts on the face and then spreads to other parts of the body, including the hands, feet, and even inside the mouth. The rash goes through several stages, starting as flat, red spots, which then become raised and filled with fluid, turning into pustules. Over time, these pustules become crusty, scab over, and eventually fall off. This process can take anywhere from 2 to 4 weeks, during which the person remains contagious. In some cases, the symptoms can become more severe. The pustules can become large and painful, and there's a risk of secondary infections if they are not properly cared for. Some people might also develop complications such as respiratory distress, sepsis, or even inflammation of the brain. These complications can be more common in people with weakened immune systems, children, or those with pre-existing health conditions. It's important to seek medical attention if you or someone you know shows any signs of monkeypox, especially if symptoms seem to be worsening. Early diagnosis and supportive care can make a significant difference in managing the disease and reducing the risk of serious complications. Understanding how monkeypox is transmitted is essential for preventing its spread. The virus can be transmitted in several ways, starting with animal-to-human transmission. This type of transmission usually occurs through direct contact with the blood, bodily fluids, or skin lesions of infected animals. Common sources include rodents like squirrels, rats, and other small mammals, which are considered the primary carriers of the virus. In some cases, people have contracted monkeypox by being bitten or scratched by an infected animal or through handling and consuming undercooked meat from infected animals. Human-to-human transmission of monkeypox is less common but still a significant route of spread, especially during outbreaks. This type of transmission can occur through close physical contact with an infected person. This includes direct contact with skin lesions or bodily fluids, such as from broken blisters. Additionally, the virus can be spread via respiratory droplets, particularly during prolonged face-to-face contact. This is why the virus can spread more easily within households or healthcare settings where people are in close quarters for extended periods. Another important route of transmission to be aware of is through fomites. Fomites are objects or materials that can carry infection, such as clothing, bedding, or other personal items that have come into contact with the virus. If someone touches these contaminated surfaces and then touches their face, particularly their eyes, nose, or mouth, they can become infected. This is why hygiene practices, such as regular hand washing and disinfection of surfaces, are crucial in preventing the spread of monkeypox. Understanding these different modes of transmission can help us take the necessary precautions to protect ourselves and those around us from this virus. Diagnosing monkeypox early is crucial for effective management and to prevent further spread of the virus. Early detection allows healthcare providers to isolate the infected individual, offer appropriate care, and trace and monitor their contacts to prevent an outbreak. Recognizing the symptoms early and getting a proper diagnosis is especially important because the initial signs of monkeypox can resemble other illnesses like the flu, chickenpox, or even COVID-19. The sooner monkeypox is accurately identified, the sooner steps can be taken to reduce transmission and manage symptoms effectively. To confirm a case of monkeypox, healthcare providers use a combination of diagnostic methods. The primary and most reliable method is the polymerase chain reaction PCR test, which detects viral DNA in samples taken from skin lesions. This is because the virus is present in high concentrations in the pustules or vesicles that appear on the skin, making them the best source for obtaining accurate results. During the PCR test, a healthcare professional will take a swab from the surface or fluid of a lesion and send it to a specialized laboratory for analysis. In addition to PCR tests, blood tests may also be conducted to check for the presence of the monkeypox virus or antibodies against it, indicating a recent or past infection. However, blood tests are generally less reliable for diagnosis because the virus does not stay in the bloodstream for long periods. In some cases, tissue samples from lesions may also be collected and examined under a microscope to look for the characteristic appearance of poxvirus infections. Monkeypox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Following diagnosis, your healthcare provider will monitor your condition and try to relieve your symptoms, prevent dehydration, and give you antibiotics to treat secondary bacterial infections if they develop. How is monkeypox treated? There aren't any currently approved antiviral treatments from pox. If you're very sick, your provider might prescribe antiviral drugs like Cidofovir or tecovirimat. These drugs are approved to treat other viral infections, like smallpox, but researchers need to learn more about how well they work for monkeypox. How do you prevent monkeypox? If you're at risk from pox, getting vaccinated helps stop the spread. Other forms of prevention include decreasing human contact with infected animals and limiting person-to-person spread. If you found this video informative and inspiring, please give us a thumbs up, subscribe to our channel for more health and wellness content, and don't forget to hit that notification bell so you never miss an update. And of course, we'd love to hear from you. Share your thoughts or any questions you might have in the comments below.